Hi everybody, my name is Mark Stone, Chief Executive Officer for Resources Safety and Health Queensland. Welcome to this year's Industry Leaders Briefing. To provide context and thoughts for this year's Industry Leaders Briefing, let's hear from Scott Stewart, the Minister for Resources.
Whether you're joining this year's Leaders Briefing in person or watching a recording, I thank you for your commitment to worker safety and health in the resources sector. Now, earlier this year, we were all deeply saddened at the news of Dylan Langridge and Trevor Davis tragically losing their lives while doing their job at MMG's Dougal River zinc mine. Again, I extend my condolences to the family, friends, and colleagues of these two men. When I say that the most important thing to leave a mine site each day is the worker, I really mean it. And sadly, we see too many instances where the protection of workers is not the priority, and where time, production, and profit cost someone, a family member, friend, or colleague. I can't imagine any one of us would see the lives of our loved ones as an acceptable price to pay for any commodity, whatever its value. There should be no lack of motivation to protect our workers from serious harm. Knowing where to best focus resources must benefit from continuous and open engagement between industry, workers' representatives, and of course, the regulator. I'm advised that presentations you're about to receive reflect some of the important work that Resources Safety and Health Queensland is progressing, often in collaboration with industry, including areas where the regulator has concern and wants to enable improvement. The presentations include guest speakers, span a range of hazards and risks to worker safety and health, both physical and psychosocial, both personal and process. Now, I recently asked RSHQ to start planning for a resource sector-wide safety reset to be held this October this year, building on the resets we've had in 2019 and 21. An important part of the planning will be to convene a tripartite steering committee to bring insight and support to this really important event. So in closing, I ask that we all reflect on the actions we're taking to ensure the protection of workers is the priority all of the time, not some of the time or most of the time, but all of the time. As an industry leaders briefing, this is the most relevant for executives in industry with decision-making power. You set the culture, you sanction the major projects, you make commitments to the market and to your boards. Again, I thank you for taking the time to consider the presentations that follow, ask questions, and of course, provide feedback. Thank you.
I'd like to take a few moments to provide my context to this briefing, covering RSHQ's purpose, how we are organised, and fatal accidents in the Queensland mining and quarrying sector. Like our vision for a resources sector free from fatality, serious injury, and occupational disease, our purpose is clear. First, we are a risk-based regulator with a deliberate focus on reducing serious harm. Second, we take compliance and enforcement action consistent with our public-facing policy, using all the tools in our regulatory toolkit. In practical terms, this means we spend the majority of our resources on educative and corrective activities, such as forums, alerts, bulletins, inspection and audit, and presentations. We also spend an important share of our resources on deterrent and punitive action in the form of compliance directives, dangerous situation notices, monetary fines, suspension and cancellation of licenses, and prosecution. Third, we promote improved safety and health outcomes through the delivery of a range of programs and services, including emergency preparedness and response, establishing an effective regulatory framework for the nascent hydrogen industry, and providing testing, calibration, engineering and training services. We'll see examples of these in the presentations which follow. I show this chart to give an update on how RSHQ is organised, our relationship to other government entities, and some recent changes in my team. Within the dash box are my direct reports, and I note the following changes. Nick Olstrand takes on a new role as Chief Transformation Officer, leading RSHQ's digital transformation projects, which you'll hear about shortly. Nick's team includes our growing data analytics capability, which delivers on a recommendation of the Brady Review. Many will know that prior to his appointment, Nick led the Safety in Mines Testing and Research Station, or SIMTARS. Kerry Melkishen takes on the role of Executive Director SIMTARS, having led RSHQ's occupational health team. Valuably, Kerry brings a different experience and skill set to this role and will continue the important services which SIMTARS has delivered to the industry and to the regulator for more than 3 decades. Dean Barr was recently appointed Executive Director, Occupational Health. Having worked closely with Dean since the first re-identified cases of mine dust lung disease in 2015, I'm glad to see his team continue to deliver important work health reforms and improve the regulator's risk assessment of other serious harms, both physical and non-physical. Last year, we centralized RSHQ's investigation function and appointed its first director, Serious Incident Investigation. Dave Lonton brings 3 decades of investigation and law enforcement experience across multiple sectors and leads a specialist team undertaking complex investigations. Jacques Leroux was appointed Chief Inspector of Coal Mines following the retirement of Peter Newman earlier this year. The industry and regulator benefited greatly from Peter's safety leadership, and we are fortunate to have capability and depth in appointing Jacques, while we progress our plans to permanently fill the role. Jacques brings 25 years of coal mining experience, including senior leadership positions. Further demonstrating our depth of experience, I acknowledge our acting Chief Inspector, Sean Dobson, who will brief us this year. Shona Messner was appointed Chief Inspector of Petroleum and Gas earlier this month and will act in the role while Bill Date takes recreational leave. Shona joins us from Work Health and Safety Queensland, where she leads the Major Hazard Facilities team. As a fellow regulator with expertise in process-related and other safety and health harms, we look forward to learning from Shona. Outside of the regulator, we continue to work with the Independent Commissioner for Resources Safety and Health, participate in statutory mining committees, engage with external audits undertaken by the Queensland Audit Office, support the Queensland Ombudsman in the areas of complaint investigation and public interest disclosure, and work with the Independent Work Health and Safety Prosecutor, which holds exclusive powers to prosecute serious offences under the resources legislation. Who remembers this chart? That's right. It's one of a number of findings made in the review into all fatal accidents in Queensland mines and quarries from 2000 to 2019 by Dr. Sean Brady and tabled in the Queensland Parliament in early 2020. The review was objective, forensic, and unprecedented. While the subject of this chart are the 47 workers who lost their lives over the 20-year period, the review also considered 589 serious accidents, each requiring hospital admission, 34,690 high potential incidents, and the experience and insight from industry workers, including their site management. I said the chart is one of a number of findings, but of course it's a pivotal finding, that industry should recognise it has a fatality cycle, and while the rate is far lower than in the preceding decades, the pattern suggests that in the order of 12 fatalities are likely to occur over any 5-year period, and that periods with few to no fatalities should be viewed as simply part of the cycle, not evidence of the industry becoming safer over the long term. So here we are, 3 years on from the tabling of that report. Does the mining and quarrying industry still have a fatality cycle? Sadly, yes. Sad for the grieving family and friends, sad for workmates, sad for the mine management and head office, sad for the union officials relaying the news to concerned members, sad for the political sphere who, in my experience, want so badly to fix the problem and introduce reforms, sad for the community and general public who look at an industrial sector seemingly unable to break its cycle of workplace fatality. And sad for my inspectors and other officers whose job is to respond to incidents, assist site and investigate the nature and cause. Dr. Brady said in the order of 12 fatalities would likely occur over any 5-year period. Over the 4-year period since mid-2019, 8 miners have died. As I said before, we should also pause for a moment and reflect that compounding these fatalities are several hundred serious accidents across the broader resources sector, some of which resulted in life-altering and life-shortening injury. I'm also not addressing here the burden of health-related serious harm, including the 350 confirmed cases of mine dust lung disease in current and former workers, which my colleague will talk to in a later presentation. So my message to the industry, in aggregate, is simple but not simplistic. If industry continues to take a similar approach, business model, mindset, culture, to safety and health that it has over the past 23 years, then we should expect the same outcome. While the obligation to manage risk rests with mine operators, all stakeholders could benefit from some introspection. Fatalities span the operations of majors, mid-caps, juniors and small business. No one is immune. If your reflection is that your site has been serious accident-free for many years, I'd ask that you consider why that might be and take an increased leadership role to share your safety culture. 5 of Dr. Brady's 11 recommendations are shown on this slide. I think they remain key. Here's why. The current legislation, sadly, includes some near-useless performance metrics for high-hazard industry, lost time incidents and total recordable cases. Frankly, they're part of the problem and mislead stakeholders. Each year, we review a handful of company reports to investors and markets, and while we've seen some improvement, by which I mean the adoption of serious injury metrics and a differentiation between process safety and personal safety, too many of these reports and posters at site are a distortion. As we manage what we measure, it follows that if LTI and TRC continue to determine executive remuneration and worker or contractor bonus payments, this will hinder the effective management of safety and health. Some years ago, RSHQ adopted the serious accident rate and high potential incident rate as relevant measures of safety and reporting, and we refer to them in practically every forum. We ask company executives and their boards to join us. We know incident reporting and information sharing are key. The first major project for my Chief Transformation Officer to deliver, with your ongoing support, is a new, much better incident reporting system. More on this later. Finally, on the 3 recommendations which resulted from Dr. Brady's analysis of fatality investigation reports, I can advise that these areas remain causal to recent fatalities and serious accidents, a number of which we have shared in industry forums and have published in bulletins, alerts, and periodicals. I was recently asked by a reporter if, given the answers to reducing fatalities can largely be found within the Brady Review, was I disappointed that the cycle did not show signs of being broken. I said I was bitterly disappointed, but that the regulator does see commitment and initiative being applied to the problem. Perhaps most visibly in the record attendances and participation in the regional forums we facilitate with industry, including statutory position holders. It just can't be enough in areas which really matter. Perhaps not enough in areas which objective analysis of past incidents demonstrate can, literally, mean the difference between life and death. So my message this year is not to the workers at site, nor their site management team. My message is to the chief executives, other C-suite board members, and institutional investors who sit above the operation and, variously, define or shape the strategy, set production targets, capital allocation, major contract terms, and commitments to the market. I ask that you think deeply and genuinely about how your approach can change, so that a fatality in Queensland mining and quarrying becomes a very rare event, not 12 times in any 5-year period. I can assure you that RSHQ is also thinking deeply and genuinely about this.